The Royal Liverpool Hospital is home to the busiest emergency department in the city. Registrar Kate Clark is on duty. Her first patient is Norwegian student Sverre Usland.
He's got a cut on his head. He jumped up and hit a door frame. Well, you've done a very good job of this.
I was going to tackle my friend, a football tackle. So I ran along and I jumped to tackle him, two-footed, just hurting my bit. But then I hit the door frame with my head and I went straight out. And I'm here.
Can I ask you to lift your head forward, sir? Thank you. And back again.
Sorry.
It's all right.
I hate blood.
Well, you have to be more careful then next time you go to tackle one of your friends. It goes all the way down to the bone.
Don't tell me.
Sorry.
Nah, it's all right.
I'm going to put some local anaesthetic in, and then we're going to put some stitches in. Sharp scratch.
Be nice.
I will.
What are you doing in Liverpool then?
I'm studying.
What are you studying?
Yeah, I do my MBA football industry.
Football industry?
Yeah. I'm sorry.
He's got lots of tiny hairs in the wound. If they're left, there's a risk that they can act as a focus of infection. I'm really sorry. Are you okay with me carrying on?
Yeah.
I'm sorry. Right, that's the last deep one.
It didn't hurt before I came here.
Only since I've got near to it.
Sorry about that. It's much better than when I came in. I'm very happy with the service I'm going to get. They helped me.
Sverre can go straight home.
She's not there. She's come this way.
Sister Ali Maniam has just started her shift.
Elsa's coordinating majors, so what we'll do now is just ensure that the rest of the department's got no troubles, no problems. Patients come in, just get stuck in.
176 emergency call through mail. Possible multiple stab wounds. Police are on scene of that.
Ambulance crew Chris Boyle and Irene Hyam are on their way. But first, they need to cross the Mersey.
Yeah, this job you've given us just inform the Baconhead Tunnel because we're still on the Whittle side. Where's our princess now?
The police will clear a way through the tunnel to ensure they arrive on scene within their 8-minute target.
It's here now for us, Phil.
Phil Jones has been stabbed in his head and back.
See if this sound. Now you've got a couple of stab wounds in you and this sounds silly, but have you got pains anywhere else?
Apart from your back, mate, and your head, because that's what we say.
Yeah, it is.
His girlfriend Cheryl will go with him to hospital.
Now, listen to me. See that 100? You can't get any higher than 100. That's your oxygen levels, that's what's going around your body. So it shows that's going around all right, so heart and lungs are working fine. Your blood pressure's a little bit high, but that's probably because of you've just been stabbed, you're anxious.
It does, you panic.
Well, I panic if I'd just been stabbed, yeah? All right, Phil, you'll be fine. Phil, what? Phil, I promise you, listen to me. Phil, you're not, I promise you. Okay, sweet stars, I promise. Cheryl, he's going to be okay, love, all right? I promise you, I promise. Oh, I've got a son of this age myself, and there's no way I'll let anything happen to Phil, all right? Cheryl, keep going, love. What's wrong, Phil? Where is he? All right. Let's just give a satellite to the hospital just to let them know that we're coming in with the 23-year-old that's been stabbed to the back.
At the Royal, Kate's on standby.
Just got a call to come into Resus. Somebody's been stabbed. Resus 1's free. Well, my name's Kate. I'm one of the doctors who's going to be looking after you. Turn out for me. Is it uncomfortable to breathe in and out? OK, what I'm going to do is put some local anaesthetic there and see how deep it goes, all right? Your heart's going a little bit fast, but I think some of that's because you're anxious. The gash on his back has gone through into the lung, it's punctured the lung, and it's also caused some bleeding into the chest as well. So what we're going to have to do is pop a tube into his chest to re-inflate the lung and also to get rid of some of that bleeding. What I want you to do now with this right arm is see if you can manage to get it up above your head. Right, you feel a sharp scratch first of all, and then it will sting a little bit as it goes in, okay?
It's a life-threatening situation.
Does that feel sharp?
Kate needs to make an incision into his chest and insert a tube to drain away the blood before Phil can no longer breathe.
Right, the worst bit's done now. How much we've got coming out. And you're doing fine, but you're going to be all right. That's his.
One of the surgical team arrives to assess Phil's condition.
I'll strain the pneumothorax because that's come back up. He's just going to make sure that everything is done as he's happy with, and then he'll arrange for him to be transferred to one of the surgical wards where he'll stay on for a few days.
Also on duty today is Clinical Director Peter Burdett-Smith.
What happened to you, Mr. Darcy? I fell over.
Came round the corner and he was on the floor in no time.
It's a Mike Gatting, isn't it?
Sure is.
Is that sore?
It's quite sore.
Yeah.
Not excessive.
This is such a common problem. There's a specific fractured nose clinic, and we'll book him into that next week when the swelling's gone down.
Just for the record, it was our golden wedding last Saturday. 50 years. And he goes and does that, and he blamed it on me.
Was your nose a funny shape beforehand?
Oh, it's perfect.
It was perfect. Yeah, it's a funny shape now. OK, if I can just get to your nose, that's right.
Sure.
There we go. Let me think. The face has got a very good blood supply, which means that it heals very well. But it also means that when you injure it, it bleeds a lot. Okay. The anaesthetic works almost straight away, so we don't need to wait. Just try to draw the edges together over the fracture, which is very swollen, so it's quite tricky. Yeah, it's coming together. Because if you stretch the skin too much to get the cover, then you can cut off the blood supply to the skin and then it won't heal. All right, looks a bit more like a nose now.
Oh, fine.
And we can finally let you go home.
Oh, lovely.
OK.
Thank you very much.
All right, no problem. Hold on there.
Rapid response paramedic Jason Sefton is already on a shout.
Right, I've got an emergency call just come in, and it's in the Smithdown area of Liverpool, and it's an RTA, a motorbike versus a van. Obviously, a life-threatening emergency call, without doubt. You know, motorbike, you've got no protection, you've only got your crash out, haven't you?
Philip Dong's scooter collided with a van.
Neck seems to be fine. Arms, legs, his left knee.
Off-duty paramedic Colin Thompson witnessed the accident.
Yeah, good. Where's hurting you the most now?
Your leg.
Your leg.
Phil may have injured his neck, so his helmet needs to be removed as carefully as possible.
All right, you got it. No, keep your hands down, Phil. Keep your hands down for us. Put them across your chest, mate.
Sorry, mate.
Don't lift your head. Don't lift your head.
I'm sorry, mate, but that's got to be done. I know he's got pain in his leg. He's told us of that. Unfortunately for him, we start at the top, we work down. The important stuff's at the top. I mean, your head and your spine are more important than your legs. OK, then. And just slide this underneath, yeah?
No.
My priority for now is just immobilisation.
Don't even know what happened.
You've just come off your bike. Yeah? He does seem a bit slightly concussed, possibly.
Phil's leg is immobilised in a box splint to protect it from further injury on his journey to hospital.
What we're going to do, mate, is put you on this board.
All right, Phil.
OK, yeah.
1, 2, bring him back again. That's it, right. That's the worst of it, mate.
Right, OK. We put him on a spinal board just in case of spinal injury. We don't believe so. Phil, don't worry about all this. It's just standard, OK?
1, 2, 3.
Phil will be taken to the Royal for treatment.
Hello, Major Sister.
Claire Halshaw can't close her mouth. She's been brought in by her mum.
Okay, I'm just going to Is it painful when I try to close it? I think it may be dislocated. Right. What we're going to do is pop a little drip in your hand. We're going to take you round to the other side of the department where we can keep a closer eye on you and give you a muscle relaxant. I'm just going to send you around for an x-ray first because I'm just a little bit concerned that it may actually be dislocated, not just a muscle spasm. It may be difficult sometimes, these people, particularly because hers has been out now for about 3 hours. Sometimes actually need a general anaesthetic to reduce it, so we'll have a go when she's had her x-ray done and see. Fingers crossed.
Oh, I don't laugh, I'm going to cry.
Motorcyclist Phil is taken straight into resus. Peter will oversee his care with Registrar Mark Buchanan.
He has no pain in his neck whatsoever, and he's got full sensation as normal. So that point of view, his neck has been cleared. He's off his spinal board. His only injury that he's complaining of his leg.
Can you move this leg at all?
No, right.
Too painful. Is the worst pain just around your knee?
No, it's top of your leg.
Top of your leg?
Yeah.
Okay, we need to have a look at that then. Is there any pain when I do that?
Only a bit.
A bit. It looks like you may well have broken your leg, but we need to get some x-rays done to confirm that or not.
What we might do, my friend, is just roll you over so I can just check I'm not missing anything on your back, okay? We're going to protect your leg as much as we can. 1, 2, 3. Right, my friend, let's have a look and see if I can do something with this. I'm feeling down your spine, and if it hurts, I want you to shout, ow!
You always need to examine the back of the patient as well as the front. If you only examine the front, you've only examined 70% of them. There's no untoward injuries on his back. Next step now is to get some x-rays done and see what his injuries are.
Next door is Claire. Her x-rays confirm that she's dislocated her jaw.
Yeah, should sit in there. This is just to see if it helps relax the muscles a little bit so that we can get the jaw to move. I'm just going to pop my thumbs in your mouth. Think it's moved at all, your jaw? Yeah, it's back, isn't it? Just keep your mouth closed for me now. Can you bite your teeth together? Does that feel okay? Keep your mouth closed now. All right, try not to yawn. Or do anything if you're really going to yawn. Grab hold.
Phil's x-rays are ready for review.
He's dislocated his hip. You can see this. That's what the hip should look like, and so that should be in there. The reason why it's come out of place is that the socket of this ball and socket joint is fractured. The deformity around his knee is because all the muscles are out of alignment because the hip's been dislocated.
Phil will need surgery and is taken to theatre.
515 emergency message. A 1-year-old child suspected choking another.
I always worry about them too.
Amy Campbell has been making gasping noises for the last 20 minutes.
And you've never heard of group or...
I've heard of it, but I didn't know what it was.
Right, okay. Basically, just an infection is the best I can describe it. It's a very dry thing that's going on in your throat here.
I'm a great-grandmother. My granddaughter's baby.
Give us the little one anyway, so I can have a little look at it.
Yeah.
I want to do a temperature and a couple of little bits. All right. Well, she's got this thing going on in her throat. It sounds like croup so far. I mean, you can hear her, she's like barking a bit. The treatment for it is basically steam. I mean, usually you find you put a kettle on in the room or in the shower room or a sauna. Is usually does it really well.
I thought she had something in her
Go on,
throat.
put the pasta while you're going there, get yourself ready.
Yeah.
Oh, what's this? What's this? Oh, you're not liking that, are you? 35.6, it's coming. All we can sort of really do, seriously, is nip down the hospital and transport to you. Immaculate, she is warm, pink, perfused. I mean, she's great. She's making lots of noise. Sick, it's quiet.
Great-grandmother Kathleen will go with baby Amy to Alder Hey Children's Hospital.
Starting to get a little bit busy now. HD, definitely, yes, so bright. And HD4, yes, so we're starting to fill up a bit now. It's usually around this time we start filling up.
Student John Madden has injured his neck in a game of rugby.
What happened?
I had a scrim collapse on my neck.
Right. What position do you play?
I played proper hooker. I played hooker at the time.
I just need to get to your neck so I can have a quick feel. That's all there.
Yeah, from there down, it's pretty dead.
Sorry. So it's really in the middle. Okay, that's fine. It's a long time since I did any propping. I had to give up. Everybody got too big. We'll get you round and get an X-ray of your neck. Okay, hang on there.
My mum has always been very angry about me playing rugby in the front row because she thought I was going to break my neck. And this is just going to give her an I told you so argument for the next 6 months.
The X-ray will show the severity of John's injury.
There's some soft tissue swelling, isn't there, opposite that gap. Don't like the look at this. What you look at with the spine is whether it's all in alignment. It is. It's all lined up without any problem. And I can't see any fractures in the bones themselves. But then you look at the soft tissues, and that's what I'm worried about there. Then that looks wide, and that suggests the sort of spine's opened up like that. If the ligaments have been injured and the bones aren't held together properly, you've then got an unstable neck. If you get it wrong and tell him he can get up and walk about, and he has got an unstable neck, he'd be paralysed from his neck down. So you can't take any chances about that, can you?
Peter is so concerned about John's injury, he takes him straight for a CT scan.
1, 2, 3.
Bit of a gumbo.
All right.
At work?
All right. I'll go and speak to him. The scan looks all right. That doesn't mean that you'll be playing next week. I just think he's got a bad ligament sprain to his neck now. What we need to do is get him into a cubicle and take that cover off, and then I can get him to start moving his neck around and see how much movement he's got in it. I don't want to send you home in a collar, but if it's too painful to manage without, then I will.
Feels good just to be able to move it a little bit.
What you need is some physiotherapy on your neck.
I really want to do that thing where you turn your neck and it clicks, but I can't.
I wouldn't recommend it.
Yeah.
Well, I thought he had a serious injury, but he doesn't, which is good. I like a happy ending.
John is able to go home and celebrate the good news with his teammates.
176 emergency call for 63-year-old diabetic male, possible hypo.
All there is hypoglycemic, which just means his blood sugars are low. And as I say, when you get in there, you'll probably find he'll be staggering around the place, might be slurring his words. And it looks like the drunk, actually.
So we've arrived, so we'll just go and have a look at him. So what was the first thing you noticed about him?
He was sitting on the wall with his head in his hands.
Yeah.
And I went in and got some milk and glucose for him, like I normally do. He's been a diabetic for 50 odd years. And he just got aggressive, and I knew that his blood sugar must have been rock bottom.
Should we just pop you in the back of the ambulance?
No chance. No chance.
I'll do it here. Well, would you mind if we just take your blood sugars?
No, I don't.
Yes, you've got to have your blood sugar taken.
I haven't got anything to be taken.
You've got to have your blood sugar taken.
Des, it's just so we know what we're dealing with at the moment, if that's okay.
Yeah, well, okay.
Look, now, don't get nasty.
We're not...
I don't want all this.
It's got to be done because you're not...
It hasn't got to be done.
It has.
Des, all we need to do really is just get your blood sugars back up to normal, mate, and then that's it. We can be on our way then, okay?
Well, Des, these people have come to help you.
Okay, well, off you go.
No,
well, we need to sort you out first, don't we?
Let them do your blood sugar. Come on, now don't be silly.
Des, can I just have a finger, please, just so we can take your blood sugars, mate?
Des.
Because you've got to clean a finger.
Des.
Okay.
If Des's blood sugar drops below 2, he's in danger of falling into a diabetic coma.
1.6.
Des.
Des.
Come on.
Des. We need to get some sugars into you and get it raised. They are low, mate.
He's going into home now. Des.
No, it's okay. It's okay.
Come on, let's go into your living room then. If you don't want to come to the ambulance, we'll go to the living room, eh? That's fine.
Des, need to give you some hypo stop, mate. If you can just put this in your mouth.
Thyroxine.
Okay.
Something for blood pressure.
Here's some hypo stop. It's a gel, it's a sugary gel.
It's just a sugary gel.
Try
and get it into his gums.
Have a suck on it. Sometimes you can come to people and they're actually unconscious, you know, and obviously you wouldn't be able to put things down their mouth.
Des, do you know where you are now? No, you're going to speak to me. I'm just getting a dirty look.
Des, do you know where you are?
Yes.
You're in the house. That's good, mate. That's good.
Colour's coming back.
It does. It takes a few. It takes a few minutes to. See the way
he's so
coming round now. He's a bit more with it.
What are you doing in your garden today, Des?
Just tidying up.
Just tidying up. How do you like your gardening?
Oh, I do, yeah.
You do?
See the way he's more cooperative now. It's because he was unsure of what's happened. But that's normal to happen when you have this diabetic hypo.
Counting down now. 6.6.
Yeah.
Okay, it's a bit better than 1.6, isn't it?
How do you feel at the moment?
Oh, I'm all right now, yeah.
You feel okay?
Oh, I'm ready for my tea now.
Right.
Yeah.
I'll make some toast for him, I think.
Just some tea and toast for him while he's waiting. Just keep out of that.
Any problems, you can just always get us back out. It's not a problem
And
at all.
thank you so much.
You're welcome.
Very grateful.
Okay.
Thank you.
Des, you take care. Okay. Take care, Des. Okay. Bye-bye now.
Thank you. Bye now. Thank you.
In resus, Kate's treating David Waits, who's had an unusual accident in his bathroom.
I don't know how far it went in. Did you pull it out, or as you got up, did it come out? It came out. Did you hurt yourself anywhere else? This gentleman was unfortunately getting out of the shower and he slipped on some water on the floor, and as he fell he's got a plant in the bathroom which is supported by a bamboo pole, and he's put his arm out, he's landed and the bamboo post is pierced underneath his arm. Well, you can see it goes quite deep. I think what we'll probably be best doing is putting some local anaesthetic in, and then we'll just go with a probe. That's the only way I can get my finger, and that's right. You okay there? Oh. Right. And I just had to feel inside the wound to see how deep it goes. The wound goes into the sort of fleshy tissue around the armpit. It's very unlikely to have done any serious damage. So we need to really just make sure it's properly cleaned out, get rid of any muck and stuff that's there, and then close it.
Well, that was a bit weird, that one, yeah. I felt a finger going round. As long as there's no damage, it's okay.
It's quite nice when you get people who've got different wounds and you give them a nice clean up, and they look nice when you've put them together. Okay, we're going to start popping some stitches in now, okay? Although it's deep, it's not a very big scar. Because we can take pretty good chunks, we just put some nice deep stitches into the skin. No, we'll be able to go home. You don't need to stay in at all.
Great.
You want to get home.
Because we've been so busy for the last few days, and I think sometimes if you get a little bit, 5 minutes, just have a straighten up and a tidy up.
176 emergency call, please. Second vehicle to scene. The taxi overturned it.
5 minutes before they're due to clock off, Chris and Irene have been called to a car crash.
There's an ambulance on scene. What I'm going to do is just have a word with the first crew on scene. They normally do a recce and just find out what we need. All right, Steve.
A car and a taxi have collided, flipping the taxi on its side. All but 2 of the passengers have managed to get out.
Do you all right here with Chris? That girl over there is okay.
All right. Aye?
Yeah. Do you want 500 ml of saline?
Give us some saline just to rinse this off.
Anne Lunt is still in the cab. She was returning from a night out with friends when the collision happened.
I haven't been inside the car yet, so I'm not really sure the condition. I think there was a medical aid team going to come from the Royal. If we can get them out, we're not going to need the medical aid team.
We're just going to sort this leg out first before we move her.
They need to get Anne out first before they can get to the other trapped passenger.
Just watch your head, hon, watch your head.
I'm moving everywhere.
Let's get a collar on her.
Annie, you okay, mate?
Okay.
Oh, I'm going to be sick. All right.
Chris moves her with caution so he can assess her in the ambulance.
Just have a lie down.
That's all right. As soon as you get home,
Let's just get you on square.
Just pop your bum on there.
Anne is going into shock.
Just come back.
Gemma?
Just come back.
Where's Gemma?
Just come back, Anne.
Okay.
Anne, we just need to keep that head nice and still. All right, just keep nice and still. All right, okay. You've got no generalised pain anywhere? No? All right, that's a good sign, that's okay. 140, 98, so blood pressure's okay. 98 sats. Can you feel me touching your legs? Equal? Right, we're going to take you to Verzackley Hospital, okay? It's probably been quite a high impact speed there. I mean, because the taxis are quite heavy, and to knock a taxi over, it's been quite an impact. So, Anne's not really complaining of any generalised pain or obvious injury. Her observations seem quite stable for what she's been through. But just because of the mechanics of the injury, and with the car going over, we're just putting her on a full spinal board and stabilising her.
Anne will be treated at Aintree Hospital.
It's been a reasonable shift, not been too bad, I think. And I'm leaving the department not in too bad a mess for my colleague, so I don't feel so bad. And for once, I'm only 10 minutes over time, so that's not too bad. I'll be home within a reasonable time tonight.
After 12 hours, I'm absolutely shattered.
So it's a glass of wine.
A glass of wine when I get home, I think, yeah, and a nice meal with the wife.
Oh no, I'm just going to get sloshed. Go to bed.
Phil spent 5 days in hospital and has now made a full recovery. Claire was kept at the Royal for a few hours of observation before her mum took her home. After 10 days in hospital, Phil is now back on the road. Anne escaped with minor damage to her knee and was released from hospital the following day.